Hi Spoonies, this is Dr. Julie. Today I would like to talk to you about oral aversion. Oral aversion can happen for many reasons. One of the most common reasons is because a child is not allowed to eat. This is either because of the risk of aspiration, choking, or due to other medical conditions. Oral aversion is very difficult to overcome. When a baby is born, we forget that we take an active role in teaching him or her how to eat, how to develop their tastes, how to get exposed to different textures. We do this through initially starting with breast milk or formula. We graduate them to cereals. We subsequently do fruits and vegetables, and then we slowly introduce them to more solid foods. If a child's not allowed to eat, they never develop their taste or their exposure to different textures. That is oral aversion, where they then themselves do not want to eat. There's nothing sadder than for me to see a baby or a child that's been cleared to eat, but he can't have his button removed because of oral aversion. I encourage you to get educated about oral aversion. I encourage you to talk to your therapist, occupational speech therapist, to your gastroenterologist, to your nutritionist about oral aversion. Until then, keep your tube safe and your babies close. Bye. Hi Spoonies, this is Dr. Julie. Today I would like to talk to you about post-surgical recovery. It's important for you to remember that it'll take approximately 2 weeks for you to have about 80% of your healing done. It takes about 6 weeks for you to complete most of your healing. So it is a very long process. Whether you're a child or an adult, it's important for you to follow your doctor's instructions to stay hydrated with water and to increase your protein intake, because your body's going to be on hypermetabolic rate, meaning that it's going to be burning a lot of calories in order to heal and recover from a surgical procedure. It's important for you to remember that you need to move around. You're going to be limited with activities, but you can exercise your legs, your hands, your arms, depending on what limitations you have. Again, follow your doctor's instructions. It's important for you to have clothing that is breathable, that is easy to put on, especially if you're limited with your range of motion to your upper extremities. It's important for you to have clothing that allows you to have access to the bandages so you can easily change them. And it's also important to make sure that it is comfortable. You want clothing to be comfortable to help you with your recovery. You want it to give it to have the adequate support to your incision, because that will help your dressing stay on longer, and it'll actually provide a little support to your incision sites. If you have drains, you want to make sure that those drains are secure. Some clothing that have pockets would be very helpful. The pulling of the drain can be very painful, but also we don't want a drain to come out before it's ready. So remember, take care of yourself, hydrate, eat more protein, get a little bit of exercise. The last thing I want to mention is that you will be prone to constipation. So if you follow a good, healthy, high fiber diet and pair it with water intake, that will help. Hi Spoonies, this is Dr. Julie. Today I would like to talk to you about skincare, particularly the skin around a G button. It's very common for us to see irritation, granulation tissue, infections, or even excoriation, skin breakdown around a new button or an old button. This typically happens for several reasons. One, especially if the button is new, it is a foreign body to your skin. It takes a while for the skin to adapt, to toughen up, and to be able to tolerate the friction that is caused just from having the button. The key to ensuring that you don't develop skin breakdown, irritation, granulation tissue is multifactorial. One is to ensure that the skin is cleaned. You can use several agents. You can also just use Baby Johnson. soap and water, but it's to really clean it thoroughly and then dry it. The key is the dryness. If you don't dry the area, or if the area stays moist, that's when you start to develop irritation to the skin. You can use different barriers out there, calmoseptine, Desitin, those are very common, Aquaphor. Those are all barriers to help protect the skin. The other thing is you want to ensure that the button fits well. The button should really sit on top of the skin. If you notice that the button is too loose, or if the button sinks into the skin, that will cause ongoing irritation from friction and from just having the stress of the button. The last thing that you want to take a look at is to ensure that the button is well secured. The more the button moves around, the more it gets tugged to one side or the other, or the more it comes out and has to be replaced. That over time will cause not just granulation tissue, but can also cause hypertrophic scars or keloids. Your skin should adapt with time and should do very well if you take care of it. Until then, keep your babies close and your tubes safe.